My name is Elizabeth, and I did my investigative immunology project on systemic lupus erythematosus, or SLE. The CDC describes systemic lupus erythematosus as an overall bodily autoimmune disorder that causes widespread inflammation of bodily tissues, specifically targeting organs such as joints, skin, blood, kidneys, brain, heart, and the lungs. The CDC goes on to say that lupus is known as a relatively rare condition with an estimated prevalence of 161,000 confirmed cases and 322,000 suspected cases. Lupus is also known to have an increased prevalence within minorities, specifically in women and potentially indigenous populations. In fact, 9 out of 10 people diagnosed with lupus were women between the ages of 15 and 45, according to Lash and Lusk in an article of 2004. The symptoms of SLE are so variable because lupus is a systemic immune response. According to the Cleveland Clinic, the symptoms can include but are not limited to muscle and joint pain, fever, rashes, extreme fatigue, kidney problems, light sensitivity, chest pain, Raynaud's phenomenon, headaches, and stomach pain. Figure 1 represents a butterfly rash, which is the main rash that is associated with systemic lupus. Now you may be wondering, how is lupus actually diagnosed? So, SLE is diagnosed through a blood test in which laboratory specialists are testing for the presence of autoantibodies. The first test that is typically done is to test for the presence of anti-nuclear antibodies, or ANA, which, if this test is positive, it represents that there are antibodies present against the nucleus of all nucleated cells. According to an article by the U.S. National Library of Medicine, this first test does not mean that a patient has lupus. Rather, it means that this patient is potentially susceptible to developing an autoimmune disease because anti-nuclear antibodies are antibodies that attack the nucleus of healthy cells. It is normal to have some of these in the blood. However, at large concentrations, it could be a sign for an autoimmune disorder. If this test does come back positive, the doctor will most likely check for 3 other clinical signs of a patient having systemic lupus erythematosus in order to receive a diagnosis. If need be, the doctor can order further testing. One of the more common tests that is done is a blood test, which tests for the presence of anti-double-stranded DNA antibodies, or dsDNA antibodies. Because at high titers, this test is almost exclusive to patients that have SLE, according to the Hospital for Special Surgery. The diagnosis process for autoimmune disease is considered a long and challenging process since the overall bodily inflammation associated with lupus could be caused by many things. The etiology of lupus is still being investigated. However, there are some suspected areas which could make someone more susceptible to developing an autoimmune condition. One of these suspected areas lies within someone's genetics. There are as many as 40 potential genes being investigated which could be linked to lupus. However, the more popular of these seem to be the genes that encode for certain proteins such as MHC, or major histocompatibility complex proteins, the genes that encode for complement proteins, the genes that encode for cytokines, and the genes that code for proteins responsible for regulating apoptosis, according to Lash and Lusk in 2004. One of the other suspected triggers could be hormones. This is suspected because of the high prevalence among reproductive age women, which suggests that female hormones such as estrogen could be partially responsible for triggering a lack of self-tolerance. The third potential cause involves environmental triggers such as ultraviolet light, infectious agents such as bacteria or viruses, and drugs such as sulfa antibiotics. All three kinds of these triggers can cause the same effect, the lack of self-tolerance. When self-tolerance is broken down, an immune response occurs to the body's own self-antigens, as shown in Figure 2. Figure 2 was taken from an article by Reeves in 2004. Now, one of the main things that occurs when the body does lose self-tolerance is that antigen-presenting cells become stimulated because of self-antigen being presented on type 2 MHC. If the antigen-presenting cell that became stimulated was a B cell, then the B cell will then move to the paracortex region of the lymph node and will interact with the T cell, causing the T cell to become activated as well. The T cell, in return, helps the B cell to undergo isotype switching, which allows for the production of self-reactive immunoglobulins. Specifically, with lupus, the immunoglobulins that are formed are IgM, IgG, and IgA, also taken from the article Lash and Lusk in 2004. Due to SLE being characterized by the production of autoantibodies, it can also be considered a type 3 hypersensitivity to oneself. The autoantibodies produced from the previous reaction can trigger the classical complement pathway, causing cell lysis of healthy cells. These complement proteins will also cause recruitment of cells within the innate immune system, such as neutrophils, thus amplifying the immune response within that tissue. As mentioned earlier, an autoreactive B cell can act as an antigen-presenting cell to form an autoreactive T helper cell. The types of T helper cells used in this response are Th1 and Th17 cells. T helper 1 cells promote oxidative stress and also promote inflammation through the production of interferon gamma. T helper 2 cells have oppositional effects through the production of interleukin-4, and it has been suggested that a higher than normal interferon gamma to IL-4 ratio could indicate higher levels of lupus activity. T helper 17 cells mainly contribute during extreme flare-ups and secrete interleukin-17, which has been known to ramp up inflammation and recruit neutrophils to the area, particularly in areas such as the kidneys, thus contributing to problems associated with lupus, such as lupus nephritis, according to Acapazzato et al. In 2023. Lupus nephritis is a type of kidney inflammation that occurs in some people who have lupus. Lupus tends to run in patterns of remission and flare-ups. So although there is no cure, these flare-ups can be managed using some different medications. According to an article by McKeon and Jiang in June of 2020, one of the main medications used is corticosteroids. Corticosteroids have anti-inflammatory effects but also can damage organs, so it's used sparingly during intense flare-ups. This article went on to explain two other types of drugs, anti-proliferative drugs and cyclophosphamide. Anti-proliferative drugs are used as an immune system suppressant, which causes the person's B and T cells to not be able to proliferate, thus minimizing tissue damage and inflammation associated with lupus. Cyclophosphamide is an alkylating agent that is used when lupus is affecting necessary organs, particularly the kidneys and nervous system. This drug is an immunosuppressant that causes lupus to enter the remission phase. Another article by the Lupus Foundation of America discussed the drug belimumab as a type of treatment. Belimumab is a type of monoclonal antibody treatment that inhibits B cell activating factor, or BAFF, which prevents B cells from activating and making more autoantibodies. In conclusion, lupus is a lifelong autoimmune disease that is still being researched. SLE is systemic, meaning the whole body is affected, causing widespread inflammation in many bodily tissues, which ultimately can damage these bodily tissues due to the prolonged immune response. The trigger for lupus is likely due to hormonal, environmental, or genetic factors, causing a lack of self-tolerance. This lack of self-tolerance mounts an immune response to self-antigen, resulting in the production of autoantibodies and self-reactive B and T cells. There is currently no cure for lupus, but flare-ups can be somewhat controlled using primarily anti-inflammatory drugs and immunosuppressants. Hopefully, lupus will be continued to be researched, and as the etiology is being discovered, hopefully more treatments can become available to patients that have this disorder.